Should you be scared of Medicare Advantage plans? If you have been doing any research into what your Medicare plan options are, then there's a strong likelihood that you've run across headlines like Medicare Advantage scam exposed. Lawmakers reignite attacks against scam Medicare Advantage plans. Medicare Advantage is a GOP scam. Medicare Advantage is a $140 billion scam. Medicare Advantage is a scam. Good old Ralph Nader. Medicare Advantage, the scam you can't afford to ignore. So, is Medicare Advantage really a scam, and should you be scared of Medicare Advantage plans, especially if you already have one? Well, today I'm going to try to answer those questions. Hi, I'm Chris Prang, the Medicare analyst, licensed insurance agent based out of Charlottesville, Virginia, and licensed in numerous other states as well. My goal is simple. It is to help you make a wise and confident decision about all of your Medicare choices. And if today is your birthday, then happy birthday to you. Not sure who said it, but there are two great days in a person's life: the day you were born and the day you discover why. First, a few disclaimers. As an independent agent, I represent every major insurance company that offers Medicare supplements, Medicare Advantage, and Part D drug plans. After 13 plus years helping thousands of Medicare beneficiaries like you, I've helped many of them enroll into a Medicare Advantage plan. I don't have a dog in this hunt. While I've helped hundreds of Medicare beneficiaries with Medicare Advantage plans, and the vast majority are very happy with their plans, if it were up to me, I just sell Medicare supplements and drug plans. But if I did, I wouldn't be fulfilling my fiduciary responsibility by giving full disclosure of all Medicare beneficiaries' plan options. And lastly, do agents really make more money selling Medicare Advantage plans? I will go over that towards the end of the video. So, is Medicare Advantage a scam? Webster's defines scam as, for a noun, a fraudulent or deceptive act or operation, and as an example, they give an insurance scam, or a verb, to deceive and defraud or to obtain something by scam. Here's what I can definitely tell you is a scam. It is the advertising and marketing of Medicare Advantage plans. It's all the ads you see on TV, the internet, flyers in the mail, the telemarketers hawking Medicare Advantage plans. Those ads are geared towards, and they definitely prey on people that are more ignorant, less educated usually, less affluent usually, older, maybe even cognitively impaired, that's a shame, and many times unhealthier. So what is Medicare Advantage, in case you don't know? Medicare Advantage is Medicare Part C. It was formerly known as Medicare Plus Choice, and it came out of the Medicare Modernization Act, passed by a Republican-controlled Congress and signed into law by President George W. Bush in 2003. So 20 years ago now. So it's a federal law and a federal program under Part C of Title 18 of the Social Security Act, and is administered through the private sector, and it is still overseen and funded by Congress and CMS. So it is not just a bunch of rogue insurance companies taking over Medicare. And on the NIH site, National Library of Medicine, it states this: the managed care organizations must provide at least a full range of benefits of Part A and Part B. In theory, managed care should offer benefits above and beyond their traditional fee-for-service program, that's original Medicare, thereby gaining favor with the Medicare population. And by the way, if you're finding this video helpful and don't want to miss other great content about understanding the pros and cons of your different Medicare options, then please consider subscribing. It is greatly appreciated. So let's address the true issues with Medicare Advantage plans. False and misleading advertising and marketing, mostly done by big insurance brokerages and bad agents. Medicare beneficiaries not fully understanding what Medicare Advantage is and isn't, and how it works and doesn't work. Also, networks. So under original Medicare and most Medicare supplements, there are no plan networks, and 97% of providers accept Medicare assignment. On occasion, you may find a provider that will not take a Medicare supplement from certain companies. They should, but they don't. And that's why I recommend using a Medicare supplement company that has been around for a while, has an A rating or higher, and offers coverage in at least half of the country. You also should avoid Medicare supplements that are called select plans or some variation of those. These supplements require you to use network providers, and you can see my video about that. For a PPO Medicare Advantage plan, you can go out of network for more money and sometimes the same amount. If you go with an HMO, then you are locked in with only network doctors. You have limited access to well-known specialty hospitals. Providers can drop out of the network at any time, which you are seeing more and more of when it comes to hospitals. But if you understand that going in and you go with a company that has a large nationwide and relatively stable network, then provider access is not as likely to be an issue. And in most cases, after negotiations and sometimes lawsuits, the hospitals are right back in the plan's network. Also with Medicare Advantage, you have the potential for high out-of-pocket costs compared to a Medicare supplement. Most Medicare Advantage plans have a max out-of-pocket limit ranging anywhere from $3,000 to $8,000. In some areas, they are much less, and the lower the better. But co-payments for just about everything that you do. A debilitating disease can cost you thousands of dollars. Dealing with high medical co-payments while having a serious disease can also add even more stress to your life. But if you understand that going in and you are prepared, then it's not such a shock. And prior authorizations and benefit denials. This is the big one. While Medicare Advantage is supposed to cover everything that original Medicare covers, because it's managed care, that means the insurance company can pick and choose what service or procedures they will cover. In reality, they end up covering most procedures and treatments. According to Health Payer Intelligence, they stated that 77% of beneficiaries have not experienced a prior authorization or denial. Now, my educated guess is that it's lower than that. Probably a lot of people have had prior authorizations they didn't experience because their provider took care of it. A survey by eHealth, take that with a grain of salt, said that 13% of people have had a prior authorization or claim denied. And you can see my video on what some agents don't like about Medicare Advantage plans and Medicare Supplement versus Medicare Advantage customer satisfaction. But there are times when you may be denied coverage, and that is not good. Let me give you a couple examples. I have a client that was on a trial drug for Alzheimer's called Leqembi. So while it was in trial, there were no costs or very little costs for that treatment. Well, now it's been officially approved and everything like that, and Medicare covers it. Well, on her Medicare Advantage plan, they have now denied her coverage, even though the doctor recommends it and even though the Leqembi has been effective in helping her with the Alzheimer's. Another example that you run into, and this is a big one, is skilled nursing. So normally your first 20 days are covered at no cost on most Medicare Advantage plans, not always, but most of the time. But if they don't see that you're improving, then they are going to tell you they're no longer going to cover you. So you have to be careful under skilled nursing. Another issue with Medicare Advantage plans is insurance companies using AI and algorithms to determine coverage. Now, this could be good and this could be bad. There are times when procedures should be denied. Unfortunately, it really should be between the doctor and the patient to determine whether care is needed. And if original Medicare were to cover, and then so should the Medicare Advantage company. Insurance companies overcharging Medicare, which means the American taxpayer is being overcharged. Of course, Medicare has a very long history of being billed for billions of dollars from fraudulent claims by doctors, hospitals, and other entities. Probably way more than Medicare Advantage companies have overcharged for. Example, doctor pleads guilty to role in $54 million Medicare fraud scam, as just one example. And there are numerous other reports which tout how Medicare Advantage saves billions of taxpayer dollars as well. So some of these physician groups that complain about Medicare Advantage companies defrauding Medicare need also to point the finger at their peers. So is the Medicare Advantage program in and of itself a scam? No. Do the big health brokerages scam people? Yes. Do some of the Medicare Advantage companies knowingly and or intentionally try to defraud the government? Probably. Do some of the Medicare Advantage companies deny coverage that they should have approved? More than likely. And does it have issues that people need to be aware of and that need to be fixed? Absolutely. Have people been scammed into getting a Medicare Advantage plan? Yes. Do some provider and hospitals have issues with Medicare Advantage? Yes. Are some hospitals dropping their network contracts with some of the Medicare Advantage companies? Yes. But ironically enough, there are many hospitals that either have their own Medicare Advantage plan or they have a special co-branded Medicare Advantage plan with an insurance company. Here are just a few examples. Centera, which is in Virginia. Johns Hopkins has its very own Medicare Advantage plan, and they are a specialty hospital. Cleveland Clinic has a co-branded plan with Humana. Kaiser, Mass General Brigham, and the University of Virginia has a Aetna co-branded Medicare Advantage plan. So obviously these well-respected hospitals don't think Medicare Advantage is a scam. Should you be scared about Medicare Advantage plans if you are considering one, or especially if you have one? No, but you should be concerned, aware, informed, truthfully about what your Medicare Advantage plan covers and how it works. And if you do have a Medicare Advantage plan, you should make sure you have the right plan for your unique needs. And if you need my help with that, see my info at the end of the video. Do I recommend Medicare Advantage plans to some people? Yes, providing they truly understand the pros and cons. It offers good prescription covers. All their doctors are in the network, and hopefully it has a very low maximum out of pocket. They are on Medicaid or maybe LIS extra help from Social Security, because then they can drop out anytime they want if they don't like it. They have the means to pay their co-payments or have Medicaid and or financial assistance from their local hospital. But I'd much rather most of my clients get a Medicare supplement and a drug plan. What I can tell you from 13 years of experience is that I have many clients on Medicare Advantage, and the overwhelming majority are very satisfied with their Medicare Advantage plan. Should they all have gotten one? No. Did I suggest they get or keep a Medicare supplement instead? Yes. I have had numerous doctors tell their patients to get a Medicare Advantage plan. I have numerous doctors, nurses, and other healthcare professionals that have chosen Medicare Advantage. I have very affluent, well-educated people on Medicare Advantage plans, and I have very poor people on them as well. I do have my concerns for sure about Medicare Advantage, which I've addressed in this video, and I hope that all the flack that they have received will cause Congress and the insurance companies to strive to solve the main problem of prior authorizations and benefit denials. And I certainly don't push Medicare Advantage plans. Most of my clients end up going with a Medicare supplement and drug plan. Now, what about commission? So Chris, do you or other agents really make a lot more commission on Medicare Advantage plans? Let's put this misinformation to rest. Recently, someone commented on my video where I explained why you should choose a PPO over an HMO when it comes to Medicare Advantage plans. It wasn't a Medicare Advantage promotion video at all. It was kind of funny. This person accused me of pushing Medicare Advantage plans simply because I did a video on why a PPO is better than an HMO. And then he stated the main reason Advantage plans are pushed by people like yourself is the commission, period. I'll be honest, I kind of feel sorry for him. This is someone who has been misinformed by someone else and is just ignorant on the matter. I asked him if he had watched any of my other videos, because if he had, he would quickly figure out that I don't push Medicare Advantage plans. Then I asked him in what way was I pushing Medicare Advantage plans, and he couldn't answer me. So to answer the question, do agents really make more selling Medicare Advantage plans as compared to Medicare supplement plans? When it comes to the initial first year commissions, they might. It just depends on a couple things. One, is the person new to Medicare Advantage, and what do Medicare supplements go for in that person's area? Some of my clients have asked me in the past how I get paid, and I have no problem telling them or you, here's how it works. If someone is new to Medicare Advantage, which usually they are not, the national commission level is $611 for the first year, then $306 after that. Some states are higher. If someone is new to Medicare Part D, then the national commission level is $100 for the first year and then $50 after that. For Medicare supplements, most companies pay agents about 22% of the premium for the commission. So if the premium is $100, the commission is $22 per month. If the premium is $200, then it's $44 per month. Now here's the kicker that most people don't disclose. In my experience, the average person on a Medicare Advantage plan only keeps that plan or stays in the books for 3 to 4 years. So if they were to keep it for 3 to 4 years and an agent gets paid $306 per year, then after 3 to 4 years, they made $918 to $1,224. If they happen to have been new to Medicare Advantage, then it was $1,223 to $1,529 over that 3 to 4 year span. But if someone gets a Medicare supplement, they are much more likely to stay on the books 7 to 8 years and many times longer. But for fun, we'll say they stay for 6 years. The average Medicare supplement premium for all ages is probably $200 plus, but let's go with $150. That means an agent is going to earn $396 per year in commission, and over 6 years will earn at least $2,376. Now add the drug plan the agent is likely going to sell them, and that's another $50 per year or another $300 in commission, thus giving a grand total of $2,676 over the life of those policies. So significantly more is made on the life of the average Medicare supplement policy. Even if someone kept their Medicare Advantage plan for 6 years, it still wouldn't equal the same commission as a Medicare supplement. So any agent that is worth their salt is going to want to sell Medicare supplements and drug plans because they earn more in the end and they are less hassle to deal with, for sure. So survey. Would you be willing to help me out and participate in a short 15-question Medicare Advantage survey? If so, and you currently have a Medicare Advantage plan, please see the link in the description to participate. I do not ask for any personal identifying information other than the state you reside in. No name, no email address, no phone number. Once the survey is completed, I'll do a video on the results. I do hope that helps and settles a couple things. Medicare Advantage is not a scam, but does have some serious flaws. But it also has some very important advantages to some Medicare beneficiaries. And as an agent, I don't push Medicare Advantage plans. I simply let you know what all of your Medicare options are so that you can make a wise and confident decision. And I certainly don't make more money selling them. When you need help, or if you ever need help making a wise choice when it comes to all your Medicare insurance options, and you live in one of the states that I'm licensed in, then please feel free to reach out to me either by phone or through one of my contact forms on my website. If you happen to live near the Charlottesville, Virginia area with an hour to an hour and a half and you would like to meet in person, then please reach out to me and we can probably work that out. That's it for today. If you want more insight on the pros and cons of your Medicare insurance, then please remember to like, subscribe, and share. I'm Chris Prang, the Medicare analyst. Make it a great day.